Basic principle of pharmacy, pharmaceutical care. Second video, SWOT analysis of pharmaceutical care. What is the SWOT? S is strength, V is weakness, O is opportunities, and T is a threat. Strength. What is the strength? High professional knowledge of the pharmacist, personal contact and communication with patients. Okay, we should have a strong personal contact and a strong communication with patients. A strong reliability of the pharmacist باید قابل اعتماد باشه. A strong ethical commitment دارای اخلاق باشه. strength scientific based marketing background مارکتینگ خوبی داشته باشه. Definitive demand from patient side. بگو definitive
demand from patient side یعنی چی؟
یعنی تقاضاهای پیشنت رو بتونه برآورده بکنه. Support from government. Strength support from government هم مهمه. Weakness low diagnostic knowledge of the pharmacist. ما قدرت دانش تشخیص نداریم ها. lack of self confidence. نه این چیزایی بده، ما نباید اینا رو داشته باشیم، ما نباید این ویکنس رو داشته باشیم، ما نبایستی low. The pharmacist shouldn't have low diagnostic knowledge of the pharmacist, shouldn't have lack of self confidence of some pharmacists. self confidence مهمه. lack of communication skill بده، lack of marketing experience بده. Exactly, the weakness is the opposite of strength. Conservative attitude of some pharmacists and lack of capital and resistance of medical doctor and nurses. resistance باشه و با اونا کامیونیکیت نکنه بده. حالا lack of capital.
من کپیتالی که باید توی یک کردم پاورپوینت معلوم کرده.
jurisdiction یعنی صلاحیت. کپیتال یعنی سرمایه. lack of capital بده، ما باید سرمایه و مالا منال یه چیزی باشه. اوکی. opportunities broadening of a sphere of activity, depending of knowledge in the area of clinical science, diagnostic and therapeutic, communication and marketing. deepening ما باید بریم تو عمق دانش clinical science, communication and marketing. personal development new service in the pharmacy and improvement in the IT و software و communication increase بشه. new service for example blood pressure measuring, advice face to face, okay, clinical pharmacy, therapy management, adherence, compliance, increase the adherence and compliance of the patient. These are the new service in the pharmacy. Okay. glucose level measuring. treat pharmacists are not willing to do this. Undereducated pharmacists will devaluate pharmaceutical care. دوست ندارن pharmaceutical care بکنن. Pharmacists are not willing to do this. In general, confidence against the pharmacist can decrease. اون وقت اعتماد به نفسش کم میشه. این دو مرتبه I think the treat is opposite of the opportunity. Super activation of competitor professions. On competitor profession, it means the medical doctor are super active. Okay. In this case, the pharmacist doesn't like to do anything. Due to economic crisis, this service will not be expoliated. یا به خاطر economic crisis بحران‌های اقتصادی دوست نداره سرویس بده. Due to change in legal circumstance, this area of profession will stop or reduce. به خاطر تغییر در legal circumstance, this area of profession will stop or reduce. level of pharmaceutical care, that's very important.
من تریت دقیقاً opportunity گفتیم.
This is the opposite of opportunity. When the pharmacists don't want to do that, undergraduated, no confidence, or maybe super activation of competitor profession due to economic crisis or because of the change in legal circumstance. قانونش اجازه نده. اوکی. levels of pharmaceutical care. first level primer, basic information together with the medicine and the health prevention. second level secondary, medication use review and adverse drug reaction report, adherence consultation, risk assessment, measurement of health indicators, patient counseling. third level therapy management, regular follow-up of patients, illness, specific consultation, etc. level of pharmaceutical care سه تا level داره. ببینید the primary level is basic information together with the medicine and the health prevention.
Second level
knowledge is the information. The second level of pharmaceutical care is medication use review, adverse drug reaction report, adherence consultation, risk assessment, measurement of health indicator, patient counseling. Third level, tertiary, is therapy management, regular follow-up of patients, illness-specific consultation, etc. Tertiary level is therapy management, regular follow-up of patients, illness-specific consultation, etc. When we do the therapy management, regular follow-up of the patient, illness-specific consultation, we do the tertiary level of pharmaceutical care. If we report the adverse drug reaction or risk assessment or health indicator or patient counseling, you see this is a patient counseling, this is a illness-specific consultation. For example, just about the diabetes, but patient counseling is just about this drug. Second level, tertiary level. That's very, very important. The levels of the pharmaceutical care. Licensure. Licensure.
اون زنه آواتا نه دست داد.
نه این پیرمرد از بوداپست اومد. پروانه.
Licensure.
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 Licensure is پروانه. همین مجوز و اینا. Licensure, basic of pharmaceutical care, is part of gradual curriculum. Basicش که الان ما پاس کردیم is a part of gradual curriculum. Primary level of pharmaceutical care, all graduate pharmacists will do. Second and third level of pharmaceutical care, a special license is needed. From the 15 of 10 of 2012, this is one of the specialization graduate pharmacists can choose as 3 years residency program. کسی که 3 سال رزیدنسی پروگرام کلینیکال فارماسی رو پاس کرده میتونه فارماکوتیکال کیر بکنه.
اما هم قضیه که کسی که به کسی میتونه داروخونه بذاره که حداقل 3 سال کار کرده باشه اینونه.
Specialization graduate pharmacists can choose. Specialization clinical pharmacy درسوز بالی نمیخواد. Summary. Pharmaceutical care is one of the services offered by public pharmacies. Pharmaceutical care is opportunity for pharmacists to improve their knowledge in the field of applied pharmacology and more. Pharmaceutical care is opportunity for pharmacists to improve their knowledge in the field of applied pharmacology and more. Higher level of pharmaceutical care can be done after a special training and under a strict condition. Higher level of pharmaceutical care can be done after a special training and under a strict condition. فقط اسپیشال ترینینگ اون 3 سال دانشگاه رزیدنتی رو میخواد. اوکی؟ ولی opportunity of pharmacists to improve their knowledge in the field of applied pharmacology and more. Applied pharmacology یعنی clinical pharmacology. Structure and contribution of internal organization in pharmaceutical care. The story of building up programs and protocols. Scheme of structure. WHO as a regional office get the order to the Eurofarm Forum. Eurofarm Forum get the order to Cindy. Cindy has a pharmadiabetes, hypertonia, asthma, etc. National outlining of program ها میاد بیرون. پس WHO, Eurofarm Forum, Syndica یا Cindy, hypertonia, asthma, pharmadiabetes, national outlining of program. The United Nations Organization and the World Health Organization. United Nations from the June 1945 and October 24, 1945 in the New York Foundation, 51 member state, today is 193. سال 1945 51 ممبر استیت بوده، علی امروز 193 کشور عضو WHO. Ends Specialization Organization FAO in Rome، UNICEF in 1946 در نیویورک، WHO در 1948 در ژنوا و UNCTAD یا UNCTAD در 1964. WHO is a regional office for Europe and the center is Copenhagen. WHO مرکز WHO در اروپا کوپنهاگن. WHO regional branch is Eurofarm Forum. مرکز WHO تو خاورمیانه تهرانه. WHO regional office for Europe is Copenhagen. اوکی. WHO regional branch Eurofarm Forum که گفت میده به سیندیکا. حالا این یوروفارم رو خواهیم یوروفارم فروم چیه؟ From A to Z Eurofarm Forum, a WHO body of pharmacy since 1992, network of WHO member state pharmaceutical organization. Mission هدفشون چیه؟ Improve health of citizens in the Europe. ACC WHO priority. Goal strengthen pharmacies یا strengthen the pharmacist position information of public health. The mission is improve health of citizen in the Europe. هدف یوروفارم فروم چیه؟ Improve health of citizen in the Europe. The goal is strengthen pharmacist position in the formation of public health. Focus on the GPP and good pharmacy practice and pharmaceutical care. Focus یوروفارم فروم رو GPP و PC. هدف pharmaceutical care. Goal is strengthen pharmacist position in the formation of public health and mission is improve health of citizens in the Europe. حالا میخوایم سر سیندی. سیندی an action plan. سیندی چیه؟ Action plan. A WHO program in which Eurofarm Forum plays an active role since 1994. Countrywide integrated non-communicable disease intervention program. برنامه کانتریوایز سراسر کشورها Integrated Non-Communicable Disease Intervention Program. Goal survey, prevention and treatment of illness due to unhealthy lifestyle. هدف سیندیکا چیه؟ سروای کردن انسان ها از مریضی prevention and treatment of illness due to unhealthy lifestyle. اگه لایف استایلشون unhealthyه ما بیایم درمان بیماریه که منجر به خاطر unhealthy لایف استایله، یعنی کل همه رو برطرف کنیم. Sharing of labor individual working group according to them and action plan. لابور یعنی کارگر. میگه که کارها و کارمندا و اینا individual working group وجود داره واسه هر اکشن پلنی. sharing of experience workshop سمینار country report cooperation، اصلا سمینار فشار خون بالا، سمینار چه میدونم دیابت. اوکی اینا کار چیه؟ سیندیکاها یا سیندی is an action plan for individual working, plan for prevention, survey and treatment of the disease, and plan for sharing of experience workshop seminar counter report and cooperation. This is Cindy. Okay? A Cindy targets at beginning asthma, diabetes, hypertonia, HIV, AIDS, smoking, self-medication. هر کدومش یه سیندیکا و سیندی داره.
مثلا سیندی اینجا خوبه، اینجا نمی‌تونم.
این سیندیه دیگه. خب حالا میخوایم بریم اینا رو توضیح بده.
سیندی مخفف چی بود؟
سیندی خودش سیندیه، به فارسی میشه سیندیکا یا انجمن صنفی یا مثلا انجمن‌های مختلف دیگه. الان انجمن چیکار میکنه؟ اکشن پلان داره. St. Vincent Declaration. A WHO meeting in 1989 in St. Vincent decided among others to enforce prevention of diabetes mellitus, to enforce early diagnosis of diabetes mellitus, to enforce management of complication of diabetes mellitus, to enforce elongation of life expectancy of diabetes mellitus patient, to enforce improvement of quality of life, and to enforce cooperation of healthcare professionals in order to fulfill AM goals. پس سنت ورسوس دکلریشن WHO میتینگی بوده. آره WHO میتینگی بوده که درباره دیابتیس mellitus prevention, early diagnosis, management of complication, life expectancy, improvement and cooperation of healthcare professional بود. Farm Diabet یا Farm Diab program is a Eurofarm forum. San Vincent Declaration of WHO first guideline and protocol is ready in 1996 outlined by pharmacists and family doctors. 10 years actualization of St. Vincent Declaration in 1999 in Istanbul. 10 سال actualization یعنی روش کار شده. Pharmacists are and remain members of the multidisciplinary teams. Pharmacists should improve their knowledge in diabetes mellitus. Member states should elaborate their own national pharmaceutical care guideline of diabetes mellitus for pharmacists. Member states should elaborate their own national pharmaceutical care guidelines of diabetes mellitus for pharmacists. In 2001, updated Eurofarm Forum protocol in 26 pages and guideline in 52 pages. 26 صفحه پروتکل داده، 52 صفحه هم گایدلاین داده در رابطه با دیابتیس mellitus. یه تکی کتابی هم آورد نشونمون داد. حالا National Outlining of Program. Hungarian Program for Pharmaceutical Care in Diabetes. First discussion and organization step در سال 2003 SWOT Private Pharmacist انجام شد. Work out the protocol accepted by MDT. Campaign preparation. کمپین لشکرکشی کمپین همون کمپین خودمونه متن اینجوری کمپین نوشته کمپین میخونه جشو نمیخونه گشو نمیخونه campaign preparation in 2004 یعنی یک سال بعد از اون training rules and textbook رو 2004 دادن start of countrywide campaign in November 14 2005 Diabetes Day روز دیابت نامیده گرفت 14 نوامبر 2005 14 نوامبر چه روزی روز دیابته participant paramesis 51 and today approximately 750 pharmacists are involved in the pharmaceutical care in diabetes. پس سال 2003 اولین دیسکاشن انجام شد تو مجارستان اوکی و بعد اومدن روز 14 نوامبر روز دیابت اعلام کردن و 750 تا هم عضو داره این اوتلاینینگشون اوتلاینینگ پروگرام. حالا این دیابت همینا این کتاب آورد نشون داد دیابتیس mellitus اوتلاین ها اینا. thank you for your attention.
اصلا هایپرتنشن ایناش بس
خب حالا اونام برای خودش مثال جداگونه داره دیگه در تو اونام سمینار میذارن
چگونه جلوگیری نفهمیدم همین چون سیندی.
خب سیندی یعنی چی؟ سیندی یعنی الان تقسیم گفتیم سیندی اکشن پلنه. بگو سیندی چیه؟ ایزن اکشن پلن WHO پروگرام یوروفارم فروم میده اونا سیندیکا میسازن country wide integrated non communicable disease intervention program هدف سروای prevention and treatment of illness مثلا تریتمنت دیابت تریتمنت hypertension due to unhealthy lifestyle sharing of labor individual working group according to them and action plan of the diabetes mellitus مثلا and sharing of experience workshops seminars countries reports and cooperation. بعد گفت سیندی target at beginning asthma, diabetes, hypertonia, AIDS, smoking and self-medication. قبوله؟ پس این اسکیما به استراکچر. حالا وقتی که ما بیایم پروفشنال بشیم روی اینا ما داریم فارماکوتیکال سرویس فارماکوتیکال کیر میدیم.